The XerosGuard tongue crib with integrated suction may be adjusted in multiple ways to allow individual customization to your patient's intraoral cavity. Here are some adjustments that will help you ideally fit XG to your patient. Adjustment 1. The wire embedded in the posable suction tubing is stronger than the external wire in the cheek retractor. This means you can set the width or amount of lateral retraction by expanding or contracting the posable suction arms. This is helpful for patients with smaller or larger than average orifice sizing. Adjustment 2. The wire embedded in the tongue crib is also posable. It is possible to expand or contract the tongue crib for patients with larger or smaller than average tongue sizing. Adjustment 3. The distal extension of the suction tube may be shortened or lengthened depending on the size of your patient's retromolar area. The posable tubing should be adjusted to comfortably clear the dentition, but ensuring no pressure is placed on the tissues behind the teeth or pterygomandibular raphe. These first 3 adjustments may be performed prior to inserting the tongue crib into the cheek retractor. It is highly recommended that you do a patient try-in without the retractor. To make these adjustments and introduce XerosGuard to your patient stepwise before graduating to the fully assembled retractor. Now let's review adjustments that will improve your access and suction functionality with cheek retractor insertion. The unadjusted tongue crib out of the box will have a tendency to sit above the floor of the mouth in most patients. Therefore, it is advantageous to pre-bend the tongue crib such that it will apply slight downward pressure intraorally. Once assembled, hold the suction tubing at the intraoral projections and simply bend the tongue crib downwards. This bend will depress the tongue crib inferiorly but causes an unwanted position or angle of the tongue crib. In order to account for this, simply hold the tongue crib at distal extensions with index fingers and depress the tongue crib. Notice now the tongue crib sits more inferiorly or towards the lower flanges of the lip cradles. These adjustments will increase the likelihood of the tongue crib resting at the floor of the mouth and the 2 distal suction ports resting at the retromolar pads, which is typically where the fluid collects. Notice the difference between the unadjusted out-of-the-box assembly and the pre-adjusted tongue crib and suction tubing position. Notice the tongue crib at the floor of the mouth and the distal suction ports sitting at the retromolar pads. These positions will help improve your intraoral access and suction functionality. Finally, if you still desire more modification to the tongue crib or suction tube positioning, you can simply adjust intraorally by pressing or pulling on any of the components mentioned. The tongue crib and integrated suction is wrapped in a soft silicone rubber coating, which eliminates the chance of pinching or poking your patient. We hope you'll enjoy the improved access and patient experience with XerosGuard. And remember, practice makes perfect with customizing your patient's isolation.